Hi, I'm Maria Gonzalez, physiotherapist and expert in non-invasive neuromodulation. I am going to tell you about a multiple sclerosis patient who actually came to consultation for intercostal pain in the 8th and 9th dorsal vertebrae, unilaterally in the right side, during 2.5 years after suffering from herpes zoster. When we make the anamnesis, the most important conclusion that we draw is that she suffers from multiple sclerosis with the following symptoms: pain, fatigue, and balance disorder. She attends these first sessions with crutches in consultation and with apparent generalized weakness. When we decided to treat her with NESA's microcurrents, she accepts this treatment, and we tell her that in this case we need her to come to consultation more frequently, since her autonomic nervous system appears to be altered, in dysautonomia, and we need to produce a frequent stimulus. Someone had to bring her, and we made that possible by doing it 3 times a week for the first 3 weeks. Afterwards, a twice-weekly treatment will be carried out as soon as we have noticed a change for the better, and then in the long run, we'll be spacing out to once a week. We explained from the beginning that we sense this will be a medium to long-term treatment. With these objectives we have said, with her symptomatology, we decided to check some scales that are in line with these objectives. For pain, we introduce VAS, Visual Analog Scale. We make a modified Borg scale for fatigue, and for her balance disorder we used a Berg scale. We start with this treatment, and since we know about the dysautonomy of her autonomic nervous system, we start with Program 1 that we are going to extend during many sessions over a long period of time. And we carry out Program 1 and Program 7 in the same session. And we repeat this treatment pattern during the first 3-4 sessions. Gradually, as the patient notices the first changes, we decided to address our first objective, which is the treatment for pain. And we started to do it with an approach focused on an improvement at the dorsal level. That is why we started with a Program 3, which will show us where we are headed to target the effect of our treatment, and a Program 7 to produce changes in the segmental autonomic nervous system. And we will continue with Program 7 at a central level. When the patient continues to improve and continues to notice these changes, we focus on pain management. But this time the first sessions will be with a Program 4 to address that pain she actually suffers from in the sagittal plane. And we will combine Program 4, Program 6, and Program 7. We will never forget to follow and finish our treatments with a job, a stimulus, at the central level with a Program 7. The patient, after the 8th session, reported very little improvement in pain, but much improvement in fatigue and sense of balance. She is already able to go for a walk with her pet in the afternoons, and she comes to consultation without crutches. This is why we change the objective, or we change the programs. We make a new combination, leaving Program 7 aside and introducing Program 8 in this period of 60 minutes. And what's the surprise? From session 13 to 14, the patient reports a significant improvement in her ability to concentrate. She is studying, in this case, she studies English and reports feeling more concentrated. Therefore, after the first 15 sessions, we want to make a new assessment, but we consider, since she is at her very best moment of improvement, to wait for the 20th session. And that's where we noticed improvement in what we had already done, which was a cardio, where heart rate variability clearly improves from 35 to 58, approaching what we consider as normal values, as is the case with SDNN and RMSSD. After 20 sessions, we decided to reevaluate the patient to obtain objective data. We found improvement in heart rate variability with the cardio, so that it passes the value of 35, which is what we consider to be already in normal values. And then we assessed SDNN, which exceeded 50, and the RMSSD, which was 53. On the other hand, she improved by 5 points on the VAS analog pain scale, and on the modified Borg scale, we found a 5-point improvement as well. Finally, when we performed the Berg scale, there was an improvement of 22 points, which gives us information about her sense of balance. This is why the patient decided to continue this treatment. She's neuromodulated for several sessions, maybe 30, 40, or 50, but the patient does not give it up because she feels an improvement in her balance, in pain, fatigue, and the ability to concentrate. Thank you very much for listening to this clinical case that I wanted to share. I hope you find it useful.